All right, you're about to see some rehab exercises that will be shown using tubing or resistance bands, okay? There's a few safety features and safety checks that I want you to do if you're using that. First of all, you need to inspect the tubing, make sure that there's no cracks, no big creases in the tubing. You always want to assume that the tubing could break. So that's why oftentimes I'll suggest using two pieces of tubing also. That way if one does break, then the other one will kind of catch you. So that's a few things of advice. The other thing is, if any of the exercises have points where you're putting a lot of pressure, leaning back, which oftentimes we will have, again, assume that it's possible that it can break. You can take a chair and put it behind you, or just always be cautious that that is a possibility. All right. The other thing is that as you're doing rehab exercises, and really all rehab, if it hurts, you want to stop. Now, a little bit of tension or discomfort is okay, but if you feel any sharpness or that it's irritating the injury, stop. The other thing you can do is go up against the edge of discomfort. So say, for example, if I'm treating my elbow and to pull across hurts, but right about there it is where I start to feel some of the pain, you can take another step away and just do little pulses against the edge of discomfort, but don't ever push it past the point of pain. So anytime we're doing especially short arcing, where you're going into a pulse, go up against the edge of pain, and then back off and just do the pulses up against that edge. All right, so always remember that safety is our number one thing. Be aware of what's around you and also the tools that you're using. All right, have fun doing the exercises. All right, today I'm going to be showing rehab for the upper back and neck. These are pretty simple, and it seems like we're doing more of the upper back for this particular round. That is probably true, but when you strengthen the upper back, we're oftentimes strengthening the neck. So this is really easy, simple exercises that you can do to strengthen that upper back. These are really good exercises if you're trapped in a bad position, really good for students, those who are at desk jobs. So if you're kind of in that hunched position, these are really good to help take some of the pressure off of that upper back and neck, okay? I'm gonna be kind of changing positions so you can see what this looks like from different angles. I'm gonna go through all the exercises, 3 rounds. We'll start with the rows. So what you're gonna do, you're gonna take your tubing that you've already check to make sure that it's good. I like doing this, if you don't have a door anchor, we're gonna use the doorknob, and since most people will have a doorknob and may not have the door anchor, we're just gonna use that, okay? For the first little bit, we're gonna go about 30 seconds to a minute of stretch. Now on this, you want to relax the shoulders. You want to bend, but not too far forward, so it's a healthy position, and really we're stretching the whole upper back, okay? So we're gonna come here for about 30 seconds to a minute. It should feel really relaxed. If you're feeling any tension, then either stand up a little bit further, or you can bend forward and you just want to let those shoulders really relax, hang, and let them stretch. Okay, after we've done that, so that's probably good for about 30 seconds to a minute. Now, I'm going to take a little pressure off. You want to bring your chest up. So I've got a good high-chested posture. You're going to bring your arms to your sides, and they're back almost as far as you think you can. We're not doing arm movements, we're doing shoulder movements. So I want you to pretend like you've got a pop can between your shoulder blades that you're going to give a little squeeze to. All right, here we go. We're going to do 10 little squeezes. So we go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Making sure there's no pain. And we're going to go back into the stretch. Now, as I'm stretching, I want you to just let that stretch. If you do experience any pain, I'll show you on the next one little modifications that you can do. We're just going to stretch. Again, you're in that stretch. Sometimes I like to even let my head go from side to side, but we want to stretch really good. And That should be good, okay? Okay, we're doing pretty good now. What I'm going to do is I'm going to turn so you can kind of see it a little bit more towards my back. And then what I'm going to do here is I'm going to pretend like there's some pain, any sharpness. Now, slight discomfort is okay, but pain we don't like. So you're going to come here. Again, high-chested posture, not too much pressure on there. Now, if I'm coming here and say it hurts right there, you back off that pain, and then we're just going to do little squeezes against the edge of discomfort, but don't go to pain. So again, little rows. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we're going to relax one more stretch. So this is our third and final stretch. I'm going to turn this way so you can see. Again, you can go forward or lean back. You want it to just be able to relax. You want to pull, let it pull in the shoulders. Nice, relaxing pull. We're going to stretch the big muscles and contract the intrinsic, the muscles closer to the spine, so that they're doing more of the work, so that those upper muscles, if you get tight shoulders and traps, those can let go. All right, we're going to do one more set here. So take a step forward, chest up, arms to your side, and we're going to do little pulses again. 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then relax. Okay, so that's our 3 sets of 10 on the rows. Now we're going to go with the shrugs, okay? The shrugs, I like to shimmy up on the tubing because this is pretty long, so instead of hanging on to the handles, I'll just shimmy up. You do whatever is comfortable. I like a little pull down, not too much pull. You're going to step on the tubing with one foot, okay? It doesn't matter which foot, but just do it with one. If you do it with two, you will probably get hit in the face with the tubing, okay? And we're just going to go up into some shrugs. The same principles apply. So I'm doing a little bit of a stretch. I don't usually do the 30 seconds to a minute, but I let it just draw down, just a nice easy stretch. And then we're going to do high shrugs, like you're trying to touch your shoulders to your ears. So I'm going to go up as high as I think I can. And again, if there's any pain, so if it hurts right there, back off and just do little squeezes against the edge of discomfort. But I'm feeling okay, so I'm going to go up as high as I think I can. There's always a little pulse left, so we're going to do 10 pulses. Ready? Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Trying to draw straight up, and now we let them down. And again, you don't want to have the shoulders too far forward. You don't want to have them back. It's a good, healthy posture, just shoulders right in the middle, and we're trying to just squeeze those shoulders up to the top. Okay? You should feel a little tension. That feels really good. We can either start getting into some neck stretches that we'll do at the very end. Okay, we're going to do 10 again, our second set of 10 for shrugs. You ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax it down. Good. Again, should feel pretty good. You can tip the head at this point if you'd like. We're gonna do some neck stretches at the very end to finish up. Yeah, that feels good. I like that draw down. Should be comfortable. We're gonna do one more set of 10. Come up high and pulses. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax it down. Good. Okay, so that's now we've done our rows, we've done our shrugs. The last thing we're going to do is just our neck lateral bending. We want to do true lateral bending. I like making a shelf, so I take my hands, shelf under your chin. You don't have to do that. You can just do the stretch from side to side. Essentially what I'm trying to do is pure lateral bending. I want my head straight forward. I want to pretend like there's a nail going right down the middle of my nose, so I can't turn my head, but I can tip my head with pure lateral bending. So I'm going to put my hands under my chin, and we're just going to go from side to side, just a nice easy bend. We're going to hold for maybe 3 or 4 seconds, and then we're going to go to the other side. Sometimes you'll get a little bit of popping. This is a normal God-given range of motion, and so if there's any popping or cracking, we're going to go the other side again. As long as it's not painful, if it's just popping, then we wouldn't be worried about that. If you're my patient and you keep getting lots of clicking and popping, we can assess that. We're going to come to the other side again. But this is just good, pure lateral bending. This is motion is lotion. And again, this is pain-free motion is lotion. If you're having a lot of neck stiffness, sometimes you'll be able to go really far to one side and you won't be able to go to the other side at all. Take what your body will give you. Don't force it, don't push it. You want, all of these should be comfortable. If it's not comfortable, then we're going backwards. Okay, and we'll go to each side one more time. And again, one more to this side. And that's about it. Usually I just do, like I say, 4 to 6 to each side, just for a few seconds, and hold. Okay, that's our upper back and neck mobilization and stability. Again, this is really good, especially if you get stuck in those seated positions. If you're a student, if you're at a computer, or stress levels are high, it helps, really helps the shoulder and upper back. And that's it. All right. Hope that helps. See you guys.